incident commander. A couple of housekeeping notes here. We do have American Sign Language and Spanish interpretation channels available if you want to click over to those, if those better suit your needs. And we also have that gray slider bar that allows you to customize your view between the speakers and the presentation so that you can customize that view for whatever recording that you may need to be able to grab off of today's press conference. So without further ado, with Director Bookman and Dr. Herlihy here, we'll go ahead and send it over to Dr. Herlihy to get us started.
Right, good morning, everyone. Thank you so much for being here. As always, want to provide a quick update on our trends in the state and then also give you an update on some changes that we've made to our vaccine breakthrough dashboard to improve it. All right, so starting here, this is a figure that compares week over week case trends in the state. So each of the vertical bars that you see here shows a week's worth of data. The weeks that are shown in red are weeks where we've seen a week over week increase, and then the weeks that are shown in blue are weeks where we've seen a week over week decrease. Important to note that the last bar to the far right end of this figure is incomplete data that represents this week's data, so best to not interpret the data in that bar yet. But in looking at this data, what you'll see is that we continue to have a high rate of COVID-19 cases in the state. Last week, we saw just a small increase, a 1% increase so far this last week compared to the week before. And the week before, you can see we saw a 6% increase, and then before that, 22%. So in general, we continue to be on this upward trajectory for cases in the state, but perhaps we can interpret from this data that that increase has slowed a little bit. We know that there are some delays in reporting sometimes, and so this data will probably continue to backfill a little bit. So by the end of this week, we could see that plus 1% increase be slightly larger than it is right now. But in general, takeaway here is that we are continuing to see an increase in cases here in Colorado. Next slide, please. So this is similar data, but showing you daily trends in cases by age group across the state. As we've seen for many weeks now, the highest rates continue to be in that 5 to 11-year-old population, followed by the adult population, the 18-plus population, then the school-age kids 12 to 17 that have been eligible for vaccine a bit longer, and then our lowest rates continue to be in the 0 to 4-year-old population. One of the things that you will note on this figure, if you look at the far right end of the figure, is that we have seen these slight decreases in the last couple of days, though a little bit of a rebound in that 5 to 11-year-old population. So what's tough to know right now is if this is just some data correction, if we'll see some of this data backfill. Hard to know if these decreases that we've seen the last couple of days are going to be sustained, are probably more likely going to be corrected and start to see increases once again. So obviously throughout the pandemic, we have seen periods of increases and decreases over time, but the overall trajectory in the state continues to be an upward trajectory in cases right now. Next slide, please. All right, similarly, this is our percent positivity data. So showing you the percentage of our PCR tests that are done in the state that return positive. So you'll see that that number is also experiencing a steady upward increase for many weeks now. Really since September, we've seen a steady upward trend in the percent positivity value. Similar to our case data, we have a short term, so several days worth of a decrease, but again, difficult to know if that's a temporary decrease, and we'll see that number rebound in the next couple of days. But overall, we do continue to see very high levels of positivity, so 9.53% in the state, which is obviously well above that 5% threshold that we want to see the numbers here in Colorado. Next slide, please. Also a reminder that the vast majority of disease that we continue to see in Colorado, honestly, 100% of what we're seeing in our Sentinel surveillance data where we're doing sequencing on specimens of COVID-19 is really that just about everything that's circulating in the state right now is Delta variant. So the B.1.617.2 variant is the Delta variant, and you can see that really since late in the summer, it's been almost exclusively the only variant that is circulating here in the state. Again, keep in mind that, this is obviously part of the reason that we continue to have so many challenges in trying to control transmission is that we know that this Delta variant is much more easily spread from person to person than earlier lineages of the virus were. So again, at this point, really just about everything that is circulating in the state is the Delta variant. Next slide, please. And then finally, wanted to provide you with a quick update on our vaccine breakthrough data. So we do have a vaccine breakthrough dashboard on our website. This is a site where you can go to look at the difference in risk that might exist for people who are vaccinated when it comes to their risk of becoming a COVID-19 case, hospitalization, or death in the state. And one of the things that we recently did and updated in our dashboard last week was age adjustment to our case, hospitalization, and death data. And age adjustment is used, we really want to try and more accurately compare the risk of disease or death or hospitalization between two groups when there's very different age distributions for those two groups. And this is really important with COVID-19 vaccination data because we know that the age distribution of our vaccinated population is quite different from our age distribution of the unvaccinated population, especially given the fact that in our young children, vaccine has actually only recently become available to them. And so because of this, we use methods around age adjustment to really make sure that we're most accurately describing the risk between those two groups, the vaccinated and unvaccinated. And so with that new age adjusted methodology in place, we see that we have some updates to the overall difference in risk between the vaccinated and unvaccinated. So if you look at the figure on the left here, you'll see that individuals that are vaccinated are 3.9 times less likely to become a COVID-19 case, 10 times less likely to be hospitalized for COVID-19, and 13.4 times less likely to die from COVID-19. Another really important reminder of the impact of vaccination in protecting Coloradans, not just from infection, but obviously also from severe disease outcomes like hospitalization. And with that, I'll turn it over to Director Bookman.
Thank you, Dr. Herlihy, and thank you to everybody for joining today. I wish I had better news to report on the hospitalization front, but as of this morning, we're now up to 1,526 people in Colorado hospitalized with COVID. Over the last several days, we had seen a bit of a decrease in those numbers. Unfortunately, this morning it did turn around, and our overall upward trajectory does continue. We are not at that 1,847 peak that we saw last December, but on our current trajectory, we still do seem to be heading very much in that direction. On the next slide, we again look at the number of cases that we see each day in the blue bar graph, and then using that line graph on the orange line, we see the total number of acute care beds available. We are still seeing the lowest number of beds available in the state of Colorado than we have seen at any previous point in the pandemic. And while there are from time to time some bumps up and down like we see in all of our other data points, the overall trajectory in comparison to previous times, really puts us in a precarious position here with the total number of beds available. And just to reiterate, 80% of the people who are in hospitals today are unvaccinated. This continues to be the pandemic of the unvaccinated. The burden of the unvaccinated on our healthcare system is truly extraordinary. As we approach what is almost the 2-year mark of the beginning of this pandemic, really want to encourage everyone who has not made the decision to get vaccinated to continue to investigate whether now is the time. It is free, it is safe, it is effective, it is our tool to get out of this pandemic, and we really need to make sure that we're doing all that we can to protect the capacity of our healthcare system, which is so threatened right now. Okay. Next slide. What we have seen across our state is, the need for people to be able to show proof of vaccination. As we see, kind of a vaccine for entry policies go into effect, we want to make sure that all Coloradans are aware of the My Colorado app, which generates your smart vaccine card. And you can see that picture there in the center. It's very simple. I've got it on my phone. Go ahead and download it. It pulls up your information directly from SIS, and it's a very easy way to show your vaccine status. And it also has that QR reader, which allows businesses and venues who are requiring proof of vaccine for entry to rapidly scan your card, and know that you are safe for entry. Additionally, you can always carry your paper CDC vaccination card. Really do encourage people to take a photo of that card to make sure that you have that documentation with you at all times. Obviously, that Smart Health card is certainly a great way to go. So I think, Brian, I'll turn it back over to you.
Great. Thank you, Director Bookman and Dr. Herlihy. We'll go ahead and open things up to the media Q&A portion of this morning's press conference. We'll use the raise hand function. If you'd like to ask a question, go ahead and raise your hand and we will work through them one by one. We'll go ahead and stick with first questions first. If you have any second questions or follow-ups, you can raise your hand again. And if we have some time towards the end, we'll be happy to go back to those second questions. Please state your name and the outlet that you're from before asking your question. And if you have questions on topics that may not have been covered today or that couldn't get answered, please do email us at media_info@state.co.us and we'll get you some information as soon as possible. Let's go ahead and start with Meg Wigger.
Hello, this is Meg from the Denver Post. I had a question with what we're seeing now in terms of the hospitalizations rise. Is that in line with what's been projected where we might get close to or exceed hospital capacity by the end of December? Or is that, is this looking better or worse than that trend line they were predicting?
This is Rachel. I can take that question. So as Director Bookman mentioned and showed with the hospitalization data, we did actually see a little bit of a decrease in hospitalizations over the weekend and then early into this week. But the value that he showed today, well over 1,500, does take us back closer to those projections that we have based on the modeling work that was done last week. So we are fairly close to what those projections were showing last week.
Thank you.
All right, let's go to John Ingold.
Hi, everyone. John Ingold at The Sun. Sorry, I have a home with a sick kid today, so you can hear in the background. I'm wondering about monoclonal antibodies and if you are seeing an uptick in doses administered of that. Are people actually embracing that?
John, I'll take that one and hope your kid feels better. And we are still working to scale our monoclonal antibody efforts across the state, working with our providers, within our acute care system, our primary care system, urgent cares, and then the buses that the state has brought on. We have seen an increase in supply from the federal government. We have seen an increase in interest. And at this point, we're still working with our federal partners to get absolute clarity on the data. This is a program that has been managed federally up until this time. And so we're actually working with them to get clear weekly administration rates from all of our providers.
All right, let's go to Chris Vanderveen.
Scott and Rachel, first of all, can you hear me?
Yes.
I wanted to ask, we're at what, 1526 COVID patients right now. There's a lot of people in the state that are demanding the governor of the state do more. Just sort of, as we enter what probably is the most dangerous part of the pandemic for the state of Colorado. Is CDPHE, is the state's health department prepared to go against the wishes of the governor and implement some further health restrictions, some public health restrictions that may not be in line with the governor's philosophy on how to deal with this right now?
Chris, we have been one team from the beginning on this response. It has been an all of state effort to do this together. These are difficult times. The general public has a desire to move on from the pandemic. Unfortunately, the pandemic is not done with us. And this is something that we are all going to do together as we move into the next phase of this. I will reiterate, if this is the time to get vaccinated, to get your booster. If you're feeling sick, you need to stay home, get tested, wait for your results. And we should all be wearing masks right now. regardless of whether there is a mandate in place or not, this is a way to keep ourselves safe. And so the same public health actions that we have taken for the first 20 months here, we need to continue to do now.
All right, let's go to John Daly.
Hi there, John Daly, Colorado Public Radio. Question about masks in schools. Is the health department tracking communities where school districts have a mask policy or requirement versus those that don't, both in terms of transmission in schools and also transmission in the broader community?
This is Rachel. I can take that question. So we did do an analysis at the beginning of the school year where we compared the mask policy, we compared the rates of disease transmission in Colorado districts where masks were in use versus those where they were not in use. And we did see a clear benefit in lower case rates in districts where masks were being used in school. So we do have that evidence from earlier in the school year. There was a lot of effort involved in trying to go school by school, district by district, to really try and understand those policies. And we know that there have been changes over time, and that analysis has not been updated recently to specifically look at now. But I think I would imagine that the impact that we saw at the beginning of the school year, and where we saw a clear benefit from masks then, would certainly play out in schools now.
And then following,
Let's go to, sorry, if you want to raise your hand again, we can certainly come back if we have some time at the end there. Let's go to Jason Grunauer.
Yeah, Jason Grunauer here from Denver 7. Just curious, from your perspective, the vaccination levels across the state, how those have changed over the last 2 months, and given the fact that there hasn't been any kind of large increase, just your thoughts on the get vaccinated message coming from the state department, the state health department, and the governor. Is that working?
I think that's a good question, Jason. I think nationally we have seen a certain level of resistance to getting vaccinated within certain parts of our population, and we're going to continue this message because this is the message that helps us get out of this pandemic. And while the rates of new daily vaccinations may not be increasing the way they were in March of this year, we do still see thousands of people each day getting an additional, or getting their first dose. And as of now, more than 80% of those who are 12 and up have gotten at least their first dose of vaccine. And so we're going to continue this message because every single person who gets vaccinated helps us get one step closer to protecting our hospital capacity and seeing our lives be able to return to normal.
All right, let's go to Vinny.
Hi, this is Vinny Del Giudice at Bloomberg News in Denver. Hospital bed question. How many medical surgical beds are available? How many ICU beds are available? You say you're at the lowest, or we're at the lowest since the pandemic started. And the governor mentioned adding 500 new hospital beds last week. Wondering what the progress on that is and what it might look like. Are you looking at going back to the convention centers in Denver or Loveland, or asking hospitals to reopen wings? Thank you very much.
Thanks for the question, Vinny. I want to put the asterisk on the numbers I'm about to give because they change minute to minute as people come in and out of the hospitals, and we know that flow happens. But as of right now, we've got approximately 575 medical surgical beds available and approximately 75 ICU beds available. And that number, again, fluctuates significantly over the course of the day, but that is where we stand right now. As the governor stated, our goal is to get to 500 additional beds available in the state. And we're going to do that in a combination of ways. Really taking two paths. One of those is to work with our hospitals, the acute care hospitals that have open beds but don't have the staff to actually put patients in them. We want to identify, do they have a wing, do they have a floor, where we could open up, 15, 25 beds at any given moment and provide them with staffing. Additionally, we know that our skilled nursing facilities, our assisted living facilities have also seen great staffing challenges, and their bed capacity has reduced as well, which is kind of backing things up in the hospitals. And you have patients who are in a hospital bed who are ready to be discharged to a skilled nursing facility, but there's no bed available. And so we are working with all of our skilled nursing providers to identify where they may have beds or wings open so that we can add staffing there. And that's how we're going to get to that total of 500. We are not at this point looking at the ranch or the convention center. That infrastructure is obviously difficult to build out. And it requires, in addition to the clinical staffing, it would require all of those wraparound services. Right now, we feel that we're better suited to pursue beds in existing facilities.
All right, let's go to Kevin Torres.
Hey there, guys. Kevin Torres with Fox 31 here. A quick question for you about false negative tests and what you guys are seeing across the state and here in the metro area with specifically fully vaccinated people who are becoming ill, getting tested, the results come back negative, and then in turn turns out that they're positive. I ask because this happened to me just recently, and I was talking with a doctor over at Denver Health after meeting with them, and he was saying the last week or two, they have had case after case after case of this, of fully vaccinated people. Mind you, I'm still yet to get my booster shot. I'm scheduled in a week for that, but I have both of my other vaccinations. Are you folks seeing more of that? Is it having anything to do with the waning immunity from just the 2 shots?
Yeah, so this is Rachel. I can take that question. So certainly glad to hear you're getting your booster shot. I think that's obviously a really important message here. We know that there is evidence of waning immunity in our vaccinated population. So I think that's the most important takeaway here is that booster doses are really going to make a big difference in decreasing your individual risk of infection. And then for certain individuals, obviously risk of more severe disease outcomes as well. I'm not aware of anything that has changed recently with the virus or with tests that would result in more false negatives occurring. Things to be aware of if you are having symptoms and you have a test and you get a negative test result, certainly false negatives can happen. One thing to do in those situations, if you had something like a rapid test done, is to go to the more accurate PCR-based test. That is more likely to give you a positive result. That test is going to be more sensitive. The other thing to be aware of is there are lots of viruses circulating. We've started to see more influenza, there's RSV virus, there's lots of other things out there that are causing disease right now. So if you have a negative test, it's also possible that you have another respiratory infection. And also keep in mind, just because you test negative for COVID doesn't mean you should be out and about, because if you have a different respiratory virus, you could go on to spread that to other folks. And especially with the holidays approaching, we really want to try and minimize infections being spread from person to person, whether that's COVID or other infections at this time.
All right, let's go to Seth Klayman.
Hi guys, Seth from the Gazette. Scott, following up on your answer to Vinny, is the state on track to add 500 hospital beds, by mid-December? And where is the state at as far as bringing in the requisite staff needed to stand those up? Thank you.
Seth, it's a very new initiative, and so we're in the early stages of building this out. We've set a target of December 15th to really get there, and so right now we are working with our hospitals, working with our skilled nursing facilities, really to first do an analysis of who has beds available. And to find the places where we can match them with staff. And so we're early in the process. We've had a lot of really positive preliminary conversations where we've identified beds that are available. And once we can get staff in those to work in those beds, we can start putting patients.
All right, let's go to John Frank. John.
Director Bookman, as you said, the general public really wants to be done with the pandemic. What will it take from the state, to get their attention and make them take this seriously?
That's a really good question. I can tell you that we're all tired of this pandemic. Our team has been working around the clock for almost 2 years now. Our local public health partners have been doing the same. Our frontline healthcare workers, our frontline essential workers. So many people in our society have been working to ensure that we can keep going during this pandemic. And there is an answer to this, and it is those vaccinations. And it's also in making sure that we do the right things from a public health perspective as individuals. And it is wearing a mask when you're indoors. It is making sure that you stay home when you're sick. It's making sure that you get tested. And it's limiting your gathering sizes over the holidays. Right now, we're in a dangerous spot. And we all want to be done with this. And, again, last December when we got those first doses of vaccine at the lab, if you told me we were going to be here today, I would not have believed you. But this is our reality. And it's time for us to come together again. We need to get our boosters. We need to wear a mask. We need to stay home when we're sick, and we're going to get through this together.
All right, let's go to Marshall Zelinger.
Hi there. Sorry, I got to get situated. I'm working on a few things. Scott, you called this the pandemic of the unvaccinated, and I've heard that numerous times. We have a viewer email that asks can 20% of our population truly be the ones responsible for the surge that we're seeing? And she asks, should vaccinated perhaps not be as encouraged to go out to events, whether there's a mask involved or not, whether there's a vaccination requirement or not? Could the vaccinated be helping with the surge of what we're seeing now, because they may be asymptomatic, spreading it to the unvaccinated who feel more effects of it?
It's a pretty complex question, Marshall, but let's start with what we know, right? 80% of the hospitalizations are in the unvaccinated. And when we talk about the need to protect the integrity of our healthcare system, we know the impact that the unvaccinated are having. We also know that there is growing evidence about waning immunity from the vaccine. Now, this isn't surprising. We know that many of our vaccines require multiple doses over time. We need our annual flu shot, and it's why the governor has been so bold in really moving us rapidly towards boosters for all who are eligible. 6 months after those mRNA vaccines, and 2 months after that J&J. We know that the boosters really increase the efficacy of those vaccines again, and so it's why boosters are critically important. But yes, we also, those who are vaccinated, we have a role in this right now as well. And it doesn't take that much to put on a mask when you go to the grocery store. And we all need to be careful right now with the rates of disease that we see in our community.
All right, let's go to John Daly.
Hi, just following up on the earlier question I had about tracking what's happening in schools. I guess this is for Dr. Herlihy. What impact do you think kids are as a vector of transmission, just in general to the pandemic? And would you expect, based on the data that you gathered earlier, that that would be more of an impact in those communities where the school districts are not requiring masks?
Yes, so at this point, we continue to see the highest rates of disease transmission occurring among our school-aged children, specifically those school-aged children that are now just newly eligible for vaccination, which I think really calls for trying to bring up the immunization rates in those kids quickly, knowing that that's really where our highest rates of disease transmission are right now. Again, I can say from the data that we analyzed at the beginning of the school year, it did look like there was a clear impact from masks in preventing transmission in schools in Colorado. But I think at this point, we don't have any specific data for right now in time. We haven't revisited that analysis, but I don't have any reason to believe that analysis that we did several months ago wouldn't hold true today. So again, we continue to recommend mask use for all kids in schools across Colorado. I think it's a really important strategy, but obviously most important is to see those immunization rates among our school-age kids increase now.
All right, let's go to Miranda Page.
Can you guys hear me?
Miranda, are you there?
Yeah, can you guys hear me?
Oh yeah, you're very quiet.
Okay, sorry, I have not tried out this computer yet. My question kind of goes back to Kevin Torres when he talked about COVID testing and people who are vaccinated testing negative. I have also heard that people have taken a while to test positive for COVID. So they've maybe had COVID and then tested negative for 6 days, and then it took that long for them to test positive. If that's something that you can address, is that something you guys are seeing? How long does it take to test positive?
Yeah, so the recommendation is to, if you know of a known exposure you've had, to get tested 5 to 7 days after that exposure occurred. That's probably the ideal time to really try and balance out the, testing early enough to really try and prevent that risk of transmission to others. But trying to catch those infections before they've gone on for too long. So really that ideal time frame is probably about 5 to 7 days. There is some literature that has suggested that when individuals who are vaccinated become infected, that their viral load might be quite high, perhaps similar to individuals that have not previously been vaccinated, but those numbers might drop off more quickly. And so that could be part of the reason that there are some differences in testing that we are seeing between vaccinated and unvaccinated individuals.
All right, let's go to Meg Wingerter.
Thanks for taking another question. So there had been the various levers the state could pull, and that, as I recall, pretty much what is left is limiting more elective procedures and activating the hospital crisis standards of care. Are those things that are being discussed at this point, or is it more of a see if what you've done so far starts to turn things around, and then if it gets significantly worse, look at those?
Meg, I think we're in constant communication with hospital leaders across the state and really trying to understand exactly what their challenges are, particularly when it comes to crisis standards of care, for hospital care. We're not there yet. We continue to evaluate what other levers we might pull, like a stricter set of requirements around scheduled elective procedures. We're not there today, but we are in constant communication with our hospitals as we evaluate what the best thing to do is.
Okay, let's go back to Chris Vanderbeek.
This is a staffing question. I know that the reality is we can't sort of simply invent ICU nurses out of thin air. We need people, and we know that a lot of facilities here in Colorado are expecting staffing shortages. So I have really a two-part question. One is you had mentioned last week that a pair of additional FEMA teams might be available in Colorado. Is that true? Are they available? Are they working in any hospitals besides Parkview down in Pueblo? And two, we've sent a lot of staff in Colorado to other states. Are we getting the kind of help we need now with states that are having low activity, having staff members and nurses and other medical professionals come into the state of Colorado to help us handle this?
Thanks, Chris. I'll take that. So we do have that one federal medical team that's on the ground in Pueblo at Parkview Hospital now, continuing to work with our federal partners to get 2 additional teams into the state, moving as rapidly as we can with those federal partners. I don't have an ETA on when they will arrive, but we continue to have those positive conversations and do believe that we will have 2 more of those teams coming in. We do know for the second part of your question, many of our hospitals and healthcare systems in Colorado, span multiple states, and they are able to move staff in from areas where they have, lower volumes right now into Colorado, and they are doing that, and we're working with them to ensure that any licensing issues, any certification issues, we break down those barriers so they can move people across state lines. And then finally, we are exercising our vendor relationships to work with staffing agencies to bring in as many qualified staff members, as you said, ICU nurses, respiratory therapists, other medical providers to really staff up those beds that we're identifying.
Let's go to Kevin Torres.
We've been receiving a lot of questions from viewers about obviously mask wearing again, key social distancing in offices. Are you guys asking people to work remotely if they can as well, or anything else?
I think that right now, obviously mask wearing is an important step that people can take for individual levels of protection. And we should all be aware that there is, a lot of disease in Colorado right now, and so we do all need to be careful limiting our gathering sizes. For those who have the ability to work from home, maybe this is an opportunity to spend more time working from home to just decrease, the social contacts right now. This is not going to last forever. We are going to get through this. We're going to come out the other side of this pandemic. Right now, all that we can do to work together to protect our healthcare system should be, the top priority for all Coloradans.
All right, thank you everyone for joining us for today's press conference. If you have any questions that you'd like some additional information on or on any topics that were not covered today, please email us at media_info@state.co.us. Thanks again for joining us. Hope you have a good rest of your day.